Lung diseases not only affect the lungs and airways, but also sometimes reveal themselves on our skin. Recognizing these skin signs can be a vital clue for doctors and help us to diagnose and treat respiratory conditions. And in this video, we're going to cover some signs that you might notice on the skin, the nails, and the fingers. So first is cyanosis, a bluish tint that appears on the skin and mucous membranes when oxygen levels in the blood are low. Cyanosis can show up centrally, so on the lips and the tongue, signaling a deeper issue with oxygenation like lung disease or even heart problems. It can also appear in what we call peripheral tissues, so the fingers and the toes, often due to poor blood flow. Now, when we see cyanosis, it's a strong indicator that our oxygen levels might be critically low. Next, there's nail clubbing, a condition where the shape and texture of the fingernails and toenails change. Now, the normal angle between the nail and the nail bed disappears, and the fingertips thicken and the nails may curve downward, looking like this. Now, this soft, spongy change in the nails is associated with a range of lung conditions, from lung cancer and cystic fibrosis to tuberculosis and lung infections. But it's also important to know that finger clubbing isn't specific to lung disease, and there are lots of other potential causes, including issues with the heart and gastrointestinal system. The third thing is hypertrophic osteoarthropathy, and that is another important sign. Now, this involves clubbing of the fingers, but with added symptoms like joint pain and inflammation in the tissue around the bones. It's especially common in non-small cell lung cancers such as squamous cell carcinoma and adenocarcinoma, and it can also show up with lung abscesses or something called a mesothelioma. Now, often these joint symptoms appear before lung cancer is even diagnosed, so they can be an early warning sign. In lung cancer itself, you can get something called cutaneous metastases or skin spread of the cancer, and this can occur in about 2 to 8% of cases. Now, this typically shows up as firm, painless lumps on the chest, the neck, or the abdomen. Other skin-related signs of lung cancer include tripalms, which appear thick and velvety and look like this, acanthosis nigricans, which are dark, velvety patches often found under the armpits, which look like this, and erythema gyratorum repens, which is a wavy, ringed rash, which looks like this. Now, this is relatively rare, and you'll notice that there are these concentrically erythematous rings that have got distinctive wood grain-like appearances. Now, the rings progress in waves, with the leading edge migrating at about a rate of 1 centimetre a day. Erythema gyratorum repens is very itchy, so if you do notice this, it's important to see your doctor. Now, all of these skin signs might be early indicators of lung cancer and a way to monitor its progression, but they can be caused by other things. So, for example, acanthosis nigricans can also be caused by things like diabetes. Another sign to watch out for is superior vena cava syndrome. Here, a major vein that carries blood from the upper body back to the heart becomes blocked, often due to lung cancer. Now, this blockage causes visible swelling of the veins on the chest and the upper body, which can be quite alarming and usually indicates advanced disease, and it looks like this. Now, moving on from lung cancer, sarcoidosis is a multi-system inflammatory disease, meaning that it affects lots of parts of the body, including the lungs. And it can also cause distinct skin symptoms. So lupus pernio, for instance, causes a raised purplish lesion on the face, especially around the nose and cheeks, and is associated strongly with sarcoidosis. It can also present as painful red bumps on the lower legs known as erythema nodosum. Now, these visible skin signs can often be a clue to diagnosing sarcoidosis before the lung symptoms appear. Another illness affecting the lungs is something called cystic fibrosis, a genetic condition that affects the lungs and the digestive system, and the skin might show subtle signs. So aquagenic wrinkling, where the palms wrinkle unusually fast when wet, is one example. Cystic fibrosis can also lead to nutrient deficiency dermatitis, as people with cystic fibrosis might struggle with absorption of certain vitamins and nutrients. Now, moving to autoimmune diseases, granulomatosis with polyangiitis, previously known as Wenger's granulomatosis, can also affect the skin. Skin signs can include necrotic ulcers, particularly on the legs, and small raised dark spots caused by tiny blood vessel damage. Mouth sores and gingivitis, which is inflammation of the gums, are also common, which can give doctors a clue to consider this diagnosis in someone with lung symptoms. Eosinophilic granulomatosis with polyangiitis, which is a very long word, or Churg-Strauss syndrome, is another rare condition which affects the lungs, the skin, and the nerves. Now here, the skin may show a range of lesions from small raised spots to mottled net-like patterns known as livedo reticularis, which looks like this. Now this condition usually begins with asthma or allergies before moving on to involve other organs. Pulmonary atriovenous malformations, which are abnormal connections between the arteries and the veins in the lungs, can sometimes be seen in conditions like hereditary hemorrhagic telangiectasia. Now, people with this genetic condition might have tiny red blood vessels visible on the skin, especially on the face, the hands, and the lips, which look like this. Now, these small blood vessels, or telangiectasia, can offer an early clue for doctors to look at the lungs for possible AV malformations. Another condition is something called alpha-1 antitrypsin deficiency. Now, this is a genetic disorder that often affects the lungs and the liver, but also has a skin component. One rare sign is necrotizing panniculitis, which causes painful red nodules under the skin, especially on the trunk and the limbs. Now, these can break down and ooze an oily fluid, providing a visible clue to an underlying condition. Now, a skin sign that can show up in the nails is yellow nail syndrome, where nails grow slowly, turning thick, rigid, and yellow, and they look like this. Now, this often appears with lymphedema, which is swelling in the legs, for example, due to lymphatic blockage, and pleural effusions or fluid around the lungs. Now, yellow nails can sometimes turn green, and they're usually accompanied by a symmetrical, non-pitting leg swelling. Now, which one of these surprised you most? Let me know in the comments section, and remember to share this video with someone who might find it useful.